Good evening. Welcome to another episode of Let's Talk About Mental Health. I'm Nels Kloster. I'm an addiction psychiatrist, and I work throughout Southern Vermont.
And my name is Robert Stack. I'm a licensed alcohol and drug counselor and licensed mental health counselor. Good evening.
Yeah. And just as a reminder for people to call in with questions or to write in, our Facebook site is at www.facebook.com/letstalkvt, or you can email us at letstalkaboutmentalhealth@gmail.com.
And again, I want to thank everybody who watches the show and the comments they've been giving us. And I mentioned last week that I really would appreciate to have a dialogue with people to talk about some of the issues affecting them. So one of the things I thought I'd do tonight is recently a dear friend of mine turned to me and asked me a question. Their son had just returned from being detoxed for heroin addiction. And she was sort of like, okay, what do we do now? And normally when someone's in treatment, I say, well, they have a treatment team, and listen to what they say and follow up on their suggestions. And I guess, if my memories is correct, I mean, things didn't work out just the way they're supposed to on discharge day. Right. And there seemed to be some confusion about the whole discharge. Yeah. And there was sort of, well, I guess we're going to take him home.
Okay. Yeah.
And I don't want to say who that was or why that happened, but and so when she called me, I was sort of, I talked to her, but the thing that really struck me, and I'll ask you to add to this, follow up on some of the choices that are available for treatment. But the thing that really struck me was I didn't know her son, but I know her. And I realized how much her life had changed. That, here she was talking to me as a friend and wanting to know, my son, I love him. And, he smoked pot, he drank, but he was a good guy. And he was doing well, and he was being successful. And she told me this, and again, it's one of these stories where he got involved with pills and got involved with pain medication and then got into heroin. And it was sort of, when I talk to her, she's not naive, and she knows what it means. Like my son's a drug addict, my son is a heroin addict, and we can talk about this some more. But I was just really struck by how, for her, things had really changed at that moment. You know what I mean? Like, and I didn't hear her husband, but I'm sure that the two of them had discussions, and I could almost hear when she was saying. Well, we have him at home, which was new because he didn't live at home. He's at home now. We don't know whether we should give him the car, and doesn't have his cell phone, and you could almost see this. And this is like this is somebody in their 20s, and he's back home, and they didn't know where to go. And she was asking me about medications and aftercare, residential treatment, and we talked a little bit about that. And I made some suggestions about 12-step programs, but more than anything, and the reason it's been on my mind, and I did call her back a couple days ago. It's just so how, like, that changes everything. It's such a it's such a game changer. You know what I mean? You have that relationship, and you have all these hopes and dreams, and you're thinking that they're working things out, and he's got a girlfriend, he has a career, and then all of a sudden it's like this other thing comes into your life, and I'm sure he feels the same way. What started off as a innocent night of getting high turned out to be, full-blown heroin addiction, in trouble. And now what are his choices? And like I said, he left. I think he left treatment, maybe, not sure what happened, but they were really looking into some of the choices available.
Yeah. And I think a lot of folks, I mean, this, from our experience, especially around addiction treatment, they're looking for cure. Right, I think what a lot of us try to say is there's not really any kind of cure, but that basically now you've taken on an illness that's going to be lifelong in some fashion. Just like, I mean, when you have cancer, you'd expect that now you're committed to a long course of something. But there's still that notion if I send them away to some place fancy enough or long enough or strong enough that we'll be done with this whole thing. And I think that's where the idea still comes around about going to detox, whether it's at a hospital, residential treatment center. There are many options for that, but those are always very short-lived. I mean, the sort of detox, as you will, or sort of treatment for acute withdrawal from opiates like heroin. That's a 5-day, sort of a 10-day thing, and then it's over. And that by itself is useless treatment. And what I mean is it gets you through some discomfort, but if that's your stopping point, then you are going to continue to use drugs. The statistics are abysmal. Maybe 90% within 6 months, but the vast majority of them return to use within the first month. So I think, and too, a lot of people struggle with, okay, I want things back the way they used to be. I want this to go back to normal. I want this to be like it was before when he was 18, and it's not going to be the same. I mean, we know this from personal experience and from a professional experience too, that their lives are now irrevocably different. Yeah. And that isn't to mean that they're going to be awful or the addictions continue to rage, but it just means that now they're going to have a different relationship, and it can, when you talk to people in recovery, they talk about their life is richer for it, for the pain they've gone through, for the path that they've gone through. And I think this family needs to not look backwards, but to look forward to basically how can they remain a healthy as possible family.
And they have all these mixed feelings, and it was sort of interesting as I was talking to her, I remember years ago when I used to do a family weekend at the hospital, and sometimes family members would just be in shock almost as I was talking about it, and on one hand they would listen to me talking about treatment and the course of the illness and whatnot, and on the other hand they're struggling with this image like you were saying, but this is my daughter, this is my son. This is different. This is not, you know what I mean? Like they're not really drug addicts. They're just addicted to drugs. I mean, I don't mean that in a funny way. I
mean, like a lot of the police chiefs I've talked to and some politicians, they're like, people are like, yeah, we need to lock up these addicts and get them in jail, get them off the streets until it's their child or their partner, and then like we got to get them treatment. Yeah. So once it hits home. You develop some empathy and you develop some more insight into it, but my God, what kind of fear strikes your heart though when the first moment of realizing what's going on? Right, and
it's interesting because I did review some of the treatment options, and I said there's methadone clinics and they are available, and for some people they work really well, and it used to be this old notion that methadone was at the end of the road. It doesn't have to be at the end of the road. It could just be the most appropriate treatment. And I know for some clients, it was ideal that they went every day and got their medicine and was stabilizing, and it held them accountable. Yeah, for other people, they're more successful with Suboxone. They go on Suboxone, they get to the right dose, and they take it. They go home with it. They get involved with recovery. They get involved with recovery centers, turning points, whatever it might be. And then I also, told her, you could try NA, Narcotics Anonymous, I even made a reference to a neighbor of mine that used to live up the road. Her son was very active in NA, and I said, well, maybe you could reach out to him and see if that can help, So, I mean, on some level, I think that's where parents sort of get confused. Like, what's the best option? Send them off to Arizona or Florida or California. You turn it on TV and there's that show, We Have the Cure. Send them the anyway. But it's that sort of bewilderment. Like, what do I do? And to his credit, this young man, and I don't know him, but he was actually considered an opiate blocker. And Nortrexon, he was thinking, well, maybe that's what I should take. And I told his mother, I said, that's fine if he's willing to take it. And she said, well, I was worried that it sort of blocks the natural endorphins, or the thing that makes you feel good. Is that? Do you think that's true?
Yeah. Well, for any of these medications to work, what's happened with the opiate addiction is you've altered the opioid receptor system, and any drug you get addicted to, you've altered the receptor system that it lights up, that it turns on, and so medications can be helpful sometimes to kind of reestablish a balance in that system. And naltrexone, to work, it has to fit in the opioid receptor system. Of course, we know from a runner's high or anything else that gives us a natural pleasure, those are endorphins. That's the opioid receptor system there. So it is, it's a concern or a possibility that when you think about blocking that receptor, that you might then dampen the ability to enjoy things. Yeah. But it's much more complicated than that. Right. I mean, you have the opioid systems connected to the dopamine being the major pleasure chemical and tied to the other. So it's not so straightforward that, he's going to be on naltrexone, he's going to be depressed because he can't experience pleasure from endorphins. A possible side effect, but I mean, so many people have been on naltrexone that have not struggled with depression at all.
Right. And I think I said to her, it was sort of like when I used to ask alcoholics, I would occasionally ask them if they were willing to go on antabuse. And I don't even know if we would do it, but it was just like, are you willing to take something that would block the effect of the drug?
Where's your level of commitment?
Yeah, and some guys say, yeah, I would take it, and other people would say, well, I'm a little worried about getting sick if I drink, or but it was almost like what's your willingness, and I think that was what was nice about this young man. He was sort of willing to consider it in between being out of treatment, detox, before he could get into some other treatment. Maybe I should take an opiate blocker. And I thought that was a good sign. I mean, I thought that was a good an indicator. Now, the only thing I've noticed sometimes is that, and again, I'm not a big fan of research anymore, but the research on Trexon, on opiate blocker, is that it worked really well for some medical people who worked in the field of healthcare. And the balance was they would lose their job or something.
Right.
And somebody was observing them taking it. Was all that. It was very restricted.
You need a very big hammer hanging over your head for it to work.
And that seemed to sort of limit its effectiveness. But I think as a measurement of sort of willingness, like what, sometimes you'll run into somebody and say, I'm ready to do whatever I have to do. I don't want to go back there. And then I think that, you can look at other choices. And that's why I felt even more positive about sending them to NA. Yeah. When you send somebody to 12-step programs, if they don't want to be there, they can find 100 reasons why it doesn't work. It's not going to work.
And I mean, and one way to look at this too is that all of these treatments are about stopping this substance from turning you on. Mm-hmm. Right, from getting into the opiate receptors or the alcohol system receptors as well. And there are a number of ways to do that. And usually the more intense treatments are earlier on. For example, I'm going to residential treatment, being in the hospital. You have walls, thick brick walls, you have locked doors, and that sort of way we then protect your brain from being turned on to that substance that you like. Eventually, at some point, you have to get out there and live life. You have to be out there in the community, back with your family, back in your town, wherever that might be. And so then the aims of treatment are more about how do we sort of change your ways of thinking and feeling and acting, what community you put around yourself. And that's really sort of one way of looking at this, is what are the tools that are needed to stop your brain from being turned on to this thing so it can come back to normal and you can start to develop a richer life.
And and I hope that happens for him. What I mean, and I hope in my friend and her husband and that they deal with this and they come through this okay. But one of the things that I'm going to perhaps repeat myself is just that when I worked with some families, and I've seen it both with sometimes if you work with folks with chronic mental illness, that the person that you knew at 12, 13, 14, and then schizophrenia or bipolar occurs, they become really different, and your relationship with them changes. And I know that's true with alcoholics. I know that's true with, I worked with this one client who started young, using crack very young. And he was in at a hospital a number of times. And I got to know his mother. His mother came to family weekend that I used to do, and I got to know her. And I knew her over a long period of time. And at one point, she was sitting in front of me in the cafeteria, and she was very sort of crying. She was talking about her grandson, her grandson, right? And he was starting to get addicted. And she was so afraid that he was going to repeat what her son had repeated. Right. And she looked at me, and she was just beaten down by the disease. I mean, she didn't stop loving him, you know what I mean? But to multiple hospitalizations, legal problems, all kinds of things going on. And she just was sort of, I don't know. It's very sad. I mean, I don't know what else to say. I mean, it was so.
Yeah.
And the idea that a grandson was beginning on that path for her was almost more than she could talk about.
Well, it's grief or bereavement. It's the same thing we go through when people we love die, right? Because there's this, like Alzheimer's, I think it's very well described that this illness gets progressively worse over a period of about 10 years. And so as you see your parents or grandparents progressing through the illness, you're mourning losses of various capacity over the course of time. And so in a way, unlike sort of a more sudden death, say from a heart attack, you're watching this person die over the course of 10 years, and there's a great deal of sadness and grief around that. And it's, again, nothing is ever the way it used to be with any of our relationships. And how do you develop this relationship with this new person in a way which is one thing that's happening is our friends, our family get changed for a good.
One of the things I used to try when I worked with folks is I used to try and separate the illness from the person. And think about what a horrible illness and how you can be so angry at the illness, and yet recognize that the person is not their illness, and that the person is the person that you loved and you cared about, that was part of your life. But I don't mean to be sort of Pollyannish about this, because at some point their illness becomes their behavior, and their behavior becomes who they are, and that's what hurts. And sometimes I think it's all very nice and good to say, they're good people, they're nice people, and they have this terrible illness, and they're going to do certain things that are upsetting. But I think over time that sort of wears out. It really wears thin, or I don't know how else to say it. I mean, and it just becomes so impossible to separate. And in a way, again, not knowing her son and just knowing her, in a way I had more empathy and compassion for her than her son, because I was thinking, I hope he gets better, I hope this turns out all right, but boy, it's really going to change your relationship, and it's really going to, and there's going to be moments, and I'm not telling tales out of school, but I mean, there's going to be moments when you just feel sort of overwhelmed by it. I mean, you'll just cry. You'll be riding down the road crying about it, thinking, there's nothing I can do about this. I can't stop it.
And I miss that person that my son or my wife or my parents used to be. Yeah, there's great sadness about that. And in a way, again, like we always do, because we pass through various stages in our own lives, is you wind up, I guess, renegotiating the relationship. You try to keep things the way they are. You accommodate. You try to be helpful. Some people use the term enabling after a certain period of time if it seems to be counterproductive. But there's always going to be that dance throughout the whole course of this, and sometimes you have to have somebody else come help. Sometimes you have to accept what you can and can't do. Like being a caregiver for aging parents, you need respite every now and then. You need nursing to come into the home. Sometimes people have to go away for the hospital for their mental illnesses. Sometimes you deal with the early signs of a relapse on either drugs or schizophrenia, bipolar disorder, depression, and it really. But nobody sort of wants or expects to sign on for a course of a chronic illness the rest of their life. And I think, when you talk about vows like till death do us part, I think that implicitly understands that sometimes we are going to have to do this dance with the people we love.
And I said this, I think, in a previous show or a previous time, that I had this opportunity to watch families with schizophrenia. And this one family, they sold their business. They actually moved up to, he was in Waterbury, and then he went into a halfway house in Burlington. They moved to Burlington to be with him, to support him. And I got to know him because he was back in the hospital. And I recognized that they had sort of dedicated the rest of their life to helping their son. And I mean, that was incredible, But I've also had other people who sort of say, we have other children, we have other things that we want to do. We've done everything we can for them, and we don't know what else to do. And we don't know, and like you just said, they don't even know if they're helping anymore.
Right.
You know what I mean? It was that really kind of like, I don't know what to do. And I think that's often another piece of that.
Yeah.
So,
and there's no right answer, right?
Yeah.
Families have their own dynamics, and if you're coming from, you have to sort of protect yourself as well, right? And maybe it was very important for that one family with their identity, what they thought about being parents, how they identified themselves as parents, to follow their child, and that's what they needed to do. Whereas in another case, well, there's this what we can do. We're protecting ourselves and our family as a whole, and I think we should emphasize there's no kind of right way or wrong way to do this. And if you wrestle with the decisions you make and you wind up making decisions to protect yourself and what you can do to help a loved one with mental illness, then that's the right way to do it. If it's a tough decision made out of love, then you're doing the right thing.
right. And I'm always drawn back in it. You know, relapse is a big issue for a lot of folks in addiction and mental illness too. I mean, quite frankly, and they were asking a co-founder of AA. They said to him one day, you know, he had a friend that brought recovery to him, a guy named Ebby, and he said to him, you know, Ebby keeps relapsing. You know, have you ever given him any advice or told him what to do? And supposedly he said to him, he said, all I can say to Ebby is that, you know, and I said this to him, is that he enjoy each day, that when he's sober, enjoy it to the fullest, because I can't really promise you what's going to happen. And I think in some way, you know, I know it's a cliche, but I think in some ways it's true that, you know, sometimes when you're dealing with addiction and mental illness, you're living in fear of the future, or you're really upset about the past. And if you could just give yourself that day, if you could just be with them that day, and hopefully they're safe, and hopefully you're okay, you know, because it's, I think in some ways, when you deal with addiction, especially if you work with someone who has relapsed, who has struggled, you sort of live in fear of what's going to happen. And even when they're looking good and doing good, you doubt it. In other words, you don't even enjoy it. You know what I mean? You think, oh my God, you know. Or, you know, they're doing good now, but you got all the problems from the past. You got legal problems, money problems, and things like that. And you're sort of worried about medication compliance and whether or not they're on the right beam and all this. And I think for some families, they just almost don't get any enjoyment anymore out of it, because they're so wrapped up in A, trying to take care of them, but B, worrying about the future, or going over and over and over about what happened and whose fault it is and how it could have been different. So, you know, I think that's good advice. If you're with somebody and they struggle with a chronic illness, tell me how they're doing today.
Right.
You know, be as much as you can in today, and it's hard to do, but it's the way.
You're trying to talk us all into being Buddhists or more mindful of the moment and appreciating whatever it might be.
Yeah. There was an article in the New York Times op-ed yesterday. It said it was I think it was a critique of positive thinking, and said we should worry, but I didn't read it. I didn't want to worry anymore.
Let's keep the glow on it. Yeah. You know, actually, somebody reached out to me this week, looking for what she referred to as a sympathetic psychiatrist, evidently feeling that didn't have much of a connection with the psychiatrist she's working with now, that she wanted to sort of, she said, take control of her own life and develop a support network, and felt very much sort of boxed in by the system and by having a psychiatrist really very heavily favored medications she felt didn't honor her choice to come off of medications or see what life might be like without them. And I think that you know, we've had some guests on this show in the past, but a couple of groups that I know, like Pathways to Housing, which is throughout the state, and an organization called Inner Fire that is sort of working on the idea of was sort of a low medication and sort of supportive and lifestyle sort of environment for people with severe and persistent mental illness. That in these places, the term sympathetic psychiatrist seems to come up a lot, I think, as a cue for, you know, are you on board with a low medication or no medication sort of approach? And I just thought how, you know, terribly sad this was in this woman's case, that she felt sort of locked in to this thing that wasn't working, and that wasn't hearing anybody that was willing to work with her on this.
I know, and last year when we talked about a little bit about mental illness, one of the major complaints about mental health patients sometimes is they stop taking their meds. But nobody ever asks them why.
Right.
And, you know, and I've talked to many clients over the years, and they say, you know, to be on them all the time, it's like being in cotton. It's like, you know, it's not me. I don't experience me. And I again, you know, we had Dr. Fisherman on last year, and she said we'd have to allow for people to be a little bit more crazy. Right. And walk around a little bit more crazy, instead of figuring, no, we need to sort of, you know, get them stable, you know, get them stabilized. And I think there's that trade-off sometimes that, you know, we want them on meds because we feel that they're more stable and they're less likely to be harmful to themselves or others. And that's a good idea. On the other hand, patients sometimes feel like, well, I want to be me. I feel like the meds are too much, and I don't know how you feel, but I know when I've worked with doctors in the past, they always want to know about meds that worked.
Right.
And if they worked, let's try them again. You know what I mean? Let's try it again. And so I think sometimes it's that fine balance between having a stable life, but still having your own life, I guess. I don't know if that's the right way to say it.
And I think, you know, too, I mean, I guess it depends, too, what the doctor-patient relationship is like. This sounds like a very sort of authoritative sort of relationship, but no, this is what I do, these are the meds, and rather than more of a sort of consultative sort of relationship. And I think that's what, you know, when patients feel listened to, is they realize that there is this discussion going back and forth.
Right.
Here's what I know from my training, here's what I think might be the right approach. You know, what do you think about this? Well, no, I can't do that, but a back and forth is a conversation around this. Because you have to own your, like we had Mary Ellen Copeland last year as our first guest last season. And this idea of this sort of, you know, kind of responsibility for your own wellness is very critical. And I think that medications quite often take that away. The very passive approach, fix me now, and it ignores a longer term approach of developing the things that we think give us a rich life.
But the other thing that's worth mentioning is that sometimes they say, you know, when you listen to the patient complain about their doctor, it's really their perception and their experience, that the doctor is not like that at all. I mean, and you know, or they've been doing this for 5 years or 6 years, and the doctor's been all over the map with less meds, different meds, you know. But I think it doesn't matter. It still matters that the patient feels that the doctor isn't listening to me, and I don't have a choice, and it's happening against my will. So even if it is true, and I've seen it in the hospital, it's sort of like a new person talks to him, a new person listens to him, a new person, you know, tries something different, you know. And so I think sometimes, you know, I'm always a little cautious, like when someone tells me about some other treatment center didn't do this or didn't do that, you know. But I think I think it's worth having a fresh ear and making them feel like, listen, I'm listening to you. So did you take the client?
This is just sort of conversation is going on right now, but you know, I'd like to help because I'm sympathetic to the idea that medications are not the be-all and end-all. They're maybe not even the right answer most of the time. That almost work is the more important first step. You know, talking, changing, seeking out things that give us a quality of life are too often not looked at. This is very, I think, unfortunately, with our focus on medications as much as we have, it's very much part of this. You know, help me right now, make this easy, give me this thing that I need, which is not helpful for any aspect of mental health, be it depression, anxiety, addiction. That again, I think that's why we like so much having Marilyn Copeland last year with the RAP program. That we need to have a role in our own wellness, and if we're passive, we are not going to be healthy and well.
And I think sometimes a fresh start will give you a new hope. You know what
absolutely.
I mean, and really, that's a big deal. And I know an addiction is that not feeling trapped. Next week, we're going to have a superintendent of Wyndham Southeast Supervisory Union, Ron Staley.
Right.
He's a good friend of mine, and I really want to have him on. I want to talk a little bit about as a community resource, a school system, but also as a citizen, as a father. I'd love to hear his comments, and so I'm looking forward to it. He'll be on this show next week.
Yeah, I am too. The schools play a big role in our community, so it'd be great to have them on board.
And I really want to encourage people to contact us, please.
Thank you.